don't have any doubt, push comes to shove, my feeling is I think there is an overwhelming majority of people out there who want to see the National Care Service as we describe it. My worry is, and this is what I think this leads to sort of more political questions. There's a certain amount of double speak out there by the political classes. So the politicians out there, I've heard politicians talking about a national care service, but then they're not specific about the details, what it means. It seems very vague. It's like a nice woolly phrase. That seems warm. It's like mother's milk and apple pie. But they don't go and spell out that these are complex questions. These are political choices that's got to be made. There's political choices about how's it to be delivered, how's it to be paid for, as you said there, and how does the quality standard get guaranteed? You know, the deficiencies in the care inspectorate in Scotland are profound. They don't have the staff to make the inspections, but when they do the inspections, 40% of the facilities they inspect last year, 40% of them failed and were described as inadequate or poor. So the key question I was going to try and focus on this second part of the meeting and ask you, Trish, is the politicians that you've heard talking about the National Care Service, they never then go on to describe, they never follow up that we do with the mantra, free, publicly owned, fit, so it's free, public and fit. That's the T-shirt, right? Free, publicly owned, fit for the 21st century. And I think that let me give you two examples, for example, right? The two most important politicians in Scotland as far as this issue is concerned, one, Nicola Sturgeon, second one is Jean Freeman. She's the health minister, right? Let me give you a quote that Nicola Sturgeon said this on the 1st of September last year, delivering her programme for government. She says, the pandemic has underlined the need for improvement and reform of the social care sector. And she admitted that the government needed to build a service fit for the 21st century. This is what she said. She said, the National Health Service was born out of the tragedy of World War II. Let us resolve that we will build out of COVID-19, this crisis, a lasting and positive legacy of high-quality national care service that can be a lasting positive legacy from the corona crisis, right? That was last September. But last week, Jean Freeman, the health secretary, Nicola Sturgeon's health secretary, told the private sector's care home gathering that they have once a year, this year it's online, that she said she made it clear the SNP does not support public ownership and does not foresee the public sector taking on social care responsibilities in Scotland. My view, she said, is that private providers add real value. We need to distinguish between a national care service and a nationalised care service, she insisted. I do not support a nationalised care service run by the state. I can work happily with private providers. So ask yourself, how do we reconcile what Nicola Sturgeon said in September with the mood music that had to be radical change, like the NHS, with references to 1948, with Jean Freeman saying last week that you can stuff the idea of it being publicly owned, you can stuff the idea of it being private, or free rather, and you can stuff the idea consequently that it's fit for the 21st century. That's my worry. And I tell you, it looks like, because the Feely report is due out next week, and the next Scottish Socialist Party forum, online forum, will be about that. And I happen to think there's going to be a bloodbath, because it presages a conflict between either you're for public ownership, like the Scottish Socialist Party, or you're for private ownership of this service, like the SNP. And I say that with some passion in my voice, because I only live a few hundred yards away from the Royal Hospital for Sick Kids in Edinburgh, at Little France, right next to the new Royal Infirmary, which the SNP has privatised. It's owned by a company called the Macquarie Capital Group of Sydney, Australia, one of the most voracious privatisation companies on the planet. The company itself is called IHSL, Integrated Health Services Lothians Limited. And when we campaigned in the SSP against the privatisation of the Royal Infirmary, the SNP was against the Labour's privatisation of the Royal Infirmary. Now, when the SNP privatise things, they say Labour's PFI is bad, but the SNP's PFI is good. Now, that's rank hypocrisy. And I think one of the things I feel strongly about is the vast majority of the public in Scotland have had the wool pulled over their eyes, thinking that the Royal Infirmary, the Sick Kids Hospital in Edinburgh, belongs to us, and it belongs to a mob in Sydney, Australia, who are charging us 3 times what it would have cost to build this for ourselves. And you think, what's the cost to sick kids of that deficiency in revenue for the NHS, you know?